What is rabies? Rabies is a fatal disease transmitted by an animal bite. Its causative agent is rabies virus, also termed RV. And RV is a negative stranded RNA virus. So rabies targets our central nervous system. Its major factors in its pathogenesis is neuroinvasiousness and neurotrypsin. So neuroinvasiveness means that it is able to get into our nervous system. And neurotrypsin means that not only is it able to get into our nervous system, but it's able to live and prosper there. RV is a multigenic trait involving several elements of the RV genome. The virulence factors include the G protein, the glycoprotein, and the cytopathic effects associated with the disease. Unfortunately, the exact mechanisms of how the disease affects us in such a lethal way is still unknown. Who gets rabies? Everybody can get rabies. Anybody that's exposed to an animal that's infected can get rabies. An animal can bite an animal can bite a human, and because of that, it's considered a zoonotic disease. But the people that are most vulnerable are children under 5, and that's because they're more enticed to approach the animals, as well as those with a weakened immune system. So, where do rabies occur and why? So, rabies used to be extremely prevalent in the US and in Europe, and they were actually thought to originate in Europe. That's up until the modern medical treatments, such as the vaccinations, so it's not as prevalent in those countries anymore. The highest numbers of rabies occur in Asia, Africa, and India, and this is because of cultural beliefs as well as their medical treatment practices. So when we're talking about cultural beliefs, it's in regards to the fact that a lot of these countries don't want to kill these animals despite how dangerous they can be. And when we're referring to medical treatment practices, there's actually groups in India who believe if you're bitten by a dog, somehow there's a puppy inside of you growing. So they delay their medical practices to visit a witch doctor. Rabies is almost non-existent in countries such as Australia and Alaska. And this is due to the fact of their location and being isolated, as well as these countries have extremely strict regulations. So when people come and visit them, they typically require that their pets are put in quarantine to prevent the spread of any potential rabies. So signs and symptoms of rabies. So once an animal or a human is bit, the first symptom is usually flu-like symptoms, such as weakness, headaches, fever, and things like that, as well as discomfort at the wound site. So wherever they're bit, it's usually tingly, itchy, and burning. Eventually, it leads to things like anxiety and confusion. And by the end, they're experiencing things such as hallucinations, insomnia, drooling, and convulsions. And unfortunately, once an individual or an animal starts experiencing clinical symptoms and signs, it's usually fatal at that point. So diagnosis, animals versus humans. Animals are usually euthanized if the rabies virus itself hasn't already killed them. This is to be able to test their brain stem and their cerebellum. This is the only way that you can confirm that an animal has rabies. But on the other hand, for humans, they have to take samples of saliva, serum, spinal fluid, and skin biopsies of hair follicles, usually at the nape of the neck. And they have to take all of these samples because one is not sufficient enough to confirm the diagnosis. And lastly, prevention and treatment, again, animals versus humans. So for dogs, cats, ferrets, usually any sort of domesticated animal, by the age of 4 months, they're required to have a rabies vaccination. If they are bit, they say for the owners to not touch the wound site and only handle the animal if required, and they need to be taken to the vet immediately for a booster. And for humans, on the other hand, we don't typically get vaccinations. The only time that we can ask a medical profession for a vaccination if we're planning to travel to other countries, usually to other countries that have known to have rabies, or their medical supplies are not readily available for us in the case of being bitten. When a human is bitten, the first course of action is the fast-acting rabies human globulin. That's the first shot that we get. The second shot, it's going to be a series of 4 shots. So the first of those 4 shots is going to be taken at the same time as the fast-acting rabies shot. And the second shot is going to be the 3rd day. The 3rd shot is going to be the 7th day. And the 4th shot is going to be the 14th day. Now, if you've already had the vaccination because you're traveling internationally, you only need 2 shots. You only need the rabies vaccines, so you need the one the day it happens, and the second one on the 3rd day. You do not need the other 2, and you do not need the rabies immune globulin shot. And that's everything about rabies.